The big subject tonight is going to be opioids. It's something as physicians who deal with chronic pain are faced with every single day, unless those physicians have taken a choice not to prescribe them, which is rather controversial, I think. In this day and age, we have a massive opioid crisis. The stats are staggering. In the US, there's 9 people an hour dying from opioid overdose deaths, and most of them are fentanyl related. In Canada, it's 13 people a day. A massive difference in populations between the two countries, but nevertheless, people dying every day or every hour, and depending on the country, and it's shocking. So we need to do everything we can to minimize this problem. So hence the need to talk about it. It's big and it's ugly, and we have an epidemic crisis, not just in North America, but across the world. So first of all, I thought I'd just share a little bit of my practice. A family physician for 16 years before I quit, and I was actively prescribing narcotics. I've had many patients on narcotics, and I've actually bought clinics in the past with a plethora of patients on not just on narcotics, but high dose narcotics. So I really have been in the mix of trying to help people in this situation. And to be honest, I've been burnt. I've tried to help people a lot, but at the end of the day, it's very challenging when people come in and say they've got pain. And as an empathetic physician who wants to help, I often just prescribe these medications. And I think there are cases where it's a good thing, and I think there's cases where it's not a good thing. So there are some rules and regulations around it to help us, but it's not easy. And and the problems that are faced are addiction. When people are on these medications, some of them end up being addicted and need higher doses. Something called tolerance builds up, and therefore they need more of the dose to get the same effect, and it just escalates up and up and up. And even though you give higher doses, it doesn't always correlate with reduction in pain scores. And in fact, we should be focusing more on the function of the patient more than the pain. Side effects from medications, often people have gastrointestinal side effects like constipation, nausea are common, but also cognitive effects in the brain, some brain fog. Some people just don't feel themselves on it. And also with that is, the risks of overdoses, which is a huge problem that we've got. And, unfortunately, if people say don't get their prescriptions from the doctor, or the doctor retires, they don't have any, then they go to the streets, and often it's laced with fentanyl. And this is where the massive deaths are coming from, because these poor people don't know what's in their street drugs, and they can die. So massive problem, and maybe a subject for another discussion here online about that. But today I was just focusing more on the problems and the pros and the cons of this medication class that we often prescribe. The other thing is other drugs like benzodiazepines, like Valium, clonazepam, lorazepam, these types of medications. And if you mix them, it can be deadly. And I've had patients die on both of these medications. So the rules and regulations is you do not mix these medications, no matter if there's a desperate need for benzodiazepines, and you don't mix them. So that would be the take-home message there. So let's flip it around. What's the place for them, right? I've seen a lot of good come from the use of medications. A patient comes to mind who was seen at a walk-in clinic, and he came to my office once. He was taking 20 Tylenols a day, 20, and that can kill you. I've had a patient once in Scotland who died from taking 10 Tylenol tablets in one go, and the patient was dead within days. It was a shocking experience for me as a young physician. But yeah, this patient I saw in my office, and I thought, well, I can help this patient. And he ended up on a 10 milligram dose of morphine twice a day. And he did remarkably well. He was stable. He came in every month or every 2 months for his prescription, and his function had improved. Another patient comes to mind who was older, over 80, and he had a lifetime of misery, literally in his bed, incapacitated for half a century. no quality of life, and his doctors had tried different medications without success. And I eventually put him on fentanyl patch, the dreaded fentanyl drug that people are dying from. But this situation, this gentleman actually got a huge benefit from his quality of life, and he was able to go back to his art, his walking, spending time with his wife, and had a good quality of life, and his life was transformed because for him that was the right medication. So I think there's no fast rules out there that we should or we should not prescribe. I think every patient is an individual, and it's up to the assessment of the doctor to what is the best thing for that patient. Just relating to some of the new information I received while in Boston in September last year at the Pain Congress, and there was a formidable public speaker and physician researcher on the subject of opioids. And one thing I took away from that lecture was that there are high risk and low risk individuals, and it's really important that physicians do assessing first before they start prescribing, because if you're a low risk individual, then a little dose of morphine is not going to do any harm as long as all the rules and regulations are followed and the patients are compliant. But if they're a high risk individual, then you're just asking for trouble, and it's almost like they're genetically predisposed to the negative effects of high doses of these medications, and under no circumstances should we go high or very high doses. I think the recommended dose from our college is 100 milligrams maximum a day, which sounds a lot, and it is a lot if you're not used to taking any, but I've had patients on a lot higher than that over my career. So is there a place for them? Yes, but we've got to be careful. So what's the take-home message tonight? Number one, I just want to introduce the subject, and because it's an opioid crisis across the world, I feel I need to have a voice on this subject, and hence the discussion. If you are on narcotics and you desperately want to come off, it's definitely something you need to discuss with your physician. And I think the big thing to mention is when you're on the narcotics, it actually causes the need for the medication. It's almost like there's an increased sensitivity to the medication, and the fear of coming off it is way worse than the actual coming off it. And I know that's something that needs to be worked through with your physician. But the narcotics actually cause more pain sensitivity, which is not commonly known in the public era or the public eye. The next thing I would say is mindset. They must have the mindset to come off it, because if you don't have the mindset to come off it, it's almost impossible. And I think as a physician, the physician needs to have the mindset to take patients down on their medications or to a more safer level, or off it altogether if that's the right thing for you. And the last thing is low dose is best. I remember a conversation with James McCormick, Prof at UBC, and in fact he's in my book, and we were talking about doses, and low dose is best. And often we find ourselves prescribing doses that are quite high or moderate to high, when in fact the low doses do the same thing. So low doses are optimal, especially in their narcotic range. So please leave a comment about my conversation tonight. If you'd like to see any subject matters covered, please drop me a line on Facebook or Instagram. That would be great, and we'll see what we can do with coming up with the subject matter. I'm here to help, here to discuss, and to share some information on these very important subjects. So just a parting comment, if you do struggle with pain, go to your local physician, whether it's your own family physician or a community-based walk-in clinic near you for a conversation. Never take street drugs. It's never advised, because you never know what's going to happen, and fentanyl could easily be laced. So as a public health measure, we should never do that for obvious reasons. But hopefully that's been helpful tonight. So have a great night, have a great day wherever you are in the world, and we'll see you next week. Thanks so much. Take care.